Hi, my name is Courtney Detwiler. I'm a second year at the University of Mississippi Medical Center School of Medicine. I am doing research in adolescent pregnancy disparities and the low birth weight rates here in Mississippi. So the background for this project, like I said, low birth weight, which is defined as less than 2,500 grams. Low birth weight is a key indicator of infant morbidity and mortality. The national low birth weight rate in 2023 was about 86 per 1,000 live births, where Mississippi's rate is substantially higher at 134 per 1,000. At the same time, Mississippi has one of the highest teen pregnancy rates in the country. Uh, you can see there 24.9, so we'll say 25 per 1,000. Because adolescent pregnancy is associated with the increased risk of adverse birth outcomes like low birth weight, it's important to study, and this study does examine the age-related differences in low birth weight across the Mississippi counties just to better understand population-level disparities and maybe potentially inform upstream prevention strategies. So the methods. I did a cross-sectional study of the 82 Mississippi counties, and I went to the Mississippi Department of Health to pull that data between 2013 and 2022. Low birth weight rates per 1,000 births were calculated for mothers under 20, so all ages under 20, and then for another group, 20 to 39. Group differences were assessed using the two-sample t-test, assuming unequal variances, and additionally, as just an observational and let's take a look kind of study, I performed a simple linear regression just to examine whether county level poverty was associated with adolescent low birth weight rates. These are the results of this study. You can see in the box and whisker plot here that for mothers less than 20, we do have a range from 0 to 212. That 0, we did have a county, Greene County, with 0 low birth weight births. That was an outlier. It did have an average of about 121. And then for mothers 20 to 39, rates were lower, 67 to 160 per 1,000 live births, with an average of about 111. Uh, you can see the t-statistic there below of 2.87, and it was significant with a p-value less than 0.01. In the regression analysis I did, poverty was a positive correlation with the low birth weight rates for adolescent mothers, but it was non-significant. And even if it was, it only explained about 3% of that variation. So this suggests that, while economic factors may contribute, they definitely don't fully explain the low birth weight rates here in Mississippi. So in conclusion, the findings in general highlight that adolescent mothers in Mississippi kind of as expected, experience higher low birth weight rates than the adult mothers. But there's this substantial variation across counties that also exist here in Mississippi. There's a weak association with poverty that was non-significant, though, but it underscores that low birth weight is a complex outcome. It's not just influenced by social or just educational or just biological factors. So, from a public health perspective, I think this just further supports the need for an upstream intervention strategy such as early comprehensive sex education, which may improve not only health literacy, but reduce unintended teen pregnancy. And this would help address root causes, which are multifactorial in low birth weight outcomes for our teen mothers. And I think that it's effective to think more downstream rather than just the clinical intervention in this downstream scenario. Sorry, I meant upstream. Anyways, here are my references, and this is the unique code. I do appreciate your time, and I hope you guys have a wonderful rest of your day. Thank you.